We're following some breaking news this morning. British Prime Minister Boris Johnson has been released from the hospital. He had spent some time in the ICU after testing positive for COVID-19.
And we are watching for several announcements this week from the state regarding COVID-19. Specifically, tomorrow we expect new information on the state website about how many ICU beds and ventilators are available, as well as the race and ethnic breakdown of patients. And sometime this week, we hope to learn how many Hoosiers have recovered from coronavirus. Nationwide, Johns Hopkins University says that number is around 32,000. And take a look at this here. This is Living Water Fellowship Church on the north side. They had a community relief drive-through this weekend. Church members say they know times are tough for a lot of people right now, and they wanted to just help get people some food and basic household supplies. Pastors tell us they were hoping to help as many as 300 families.
And a quick heads up, if you needed to get any shopping done today, a lot of stores that don't normally close for Easter Sunday will be closed this year, and that's to give employees a much-needed break. Those have been working during this pandemic. Target, Trader Joe's, Aldi, Sam's Club, Costco, and Lowe's will all be closed today. Easter celebrations will look a little bit different this year because of the coronavirus. Meredith Juliet is showing us the ways churches are changing services, of course, to follow social distancing, but to still celebrate. Good morning, Meredith.
Hey, good morning, Alyssa. Happy Easter Sunday to you. Yes, so Robert Parks United Methodist Church, they're a downtown Indianapolis church. They're doing a drive-through Holy Communion and egg. It's not really an egg hunt, really an egg giveaway, but that's happening actually right now from now to 10 a.m. And they're having people of the church drive up. They're maintaining 9 feet apart, and they're only allowed to open their windows to receive communion and to get the Easter eggs that are for the kids. This is just for members, though. You can't drive by and accept communion if you're not a member of this church, but we thought we would share that's how cool that is that they're doing that. Now, Chapel Hill United Methodist Church was going to do something like this, but as Lindsey said, there's rain showers coming into the viewing area, so they decided they aren't going to do this, and they're just sticking to their Facebook Live. But the governor has given an order that explains, guidance at least for how churches can give communion and can communicate with their parishes. Now, the purpose of this guidance is not to restrict religious liberty, but to save lives. That's from Governor Holcomb. And these are some of the conditions that he gives. Attendees must remain inside their vehicles at all times. They should not interact physically. They should only maintain in the vehicle people that they live with. You shouldn't be taking your neighbors or anything like that. So we want to know how you guys are celebrating Easter Sunday. How are you doing your Easter egg hunts? Please tweet at us using the hashtag 13sunrise. We might share your picture on our show.
Meredith, you're glowing this morning. Love the Easter yellow. Happy Easter to you.
Thank you.
In the race to stop this coronavirus outbreak, the search is on for cures. But while the president endorses a common malaria drug, not everyone is so sure. So why the confusion? Let's connect the dots. The president has urged people to take HYDROXYCHLOROQUINE, a drug primarily used to fight malaria, lupus, and rheumatoid arthritis. In the lab, it appears it may block COVID-19 from invading cells, and researchers think it might also help dampen an overactive immune system. And while there have been anecdotal reports that it has helped some patients, there is no definitive scientific proof. Early studies in China and France that found the drug could help ended up being flawed. A more recent study in China that wasn't flawed showed promise, but it was pretty small, and the authors said more research needed to be done. Since hydroxychloroquine is relatively safe, some doctors have gone ahead and prescribed it to coronavirus patients. But people do need to be careful. It is not good for anyone with abnormal heart rhythms. And some public health officials are concerned that the public will think this is a silver bullet, when the research just isn't there yet.
And Lindsey Monroe has been taking hydroxychloroquine for about 2.5 years now for lupus. And Lindsey, how does it help you?
Well, with lupus, it's essentially an autoimmune disease. So our bodies, if you have lupus, it kind of overreacts. It means my immune system does too much. So we have to take medications to get it to do just the right amount. So that's why a lot of lupus patients take the hydroxychloroquine, because it acts as an anti-inflammatory and it keeps us kind of in check. It keeps us from flaring up. So that's why it's important. And we take it on a daily basis too.
Wow. And how do you feel when you're on it? Do you have any side effects?
I personally don't, and I know some lupus patients cannot take it. It's kind of a trial and error to see what kind of drug combination actually works for each individual patient. I know a lot of lupus people who started taking it had reactions such as hives and things like actual allergies, GI issues. And then also, if you take it for a long time, you are required to get your eye exams checked because you can get something called retinal toxicity. And I'm not a doctor, so I'm just kind of regurgitating what I've been told. And that's where essentially you could go blind or lose color awareness. So there are some pretty intense things that could happen as far as side effects goes, but I have not had any of them.
That's good. I have one more question for you, Lindsey, too. I mean, you take this every day. Has it been harder for you to get your prescription at all?
Personally, no. I use a 90-day kind of mail-in order service, so that's actually kind of nice. I've been able to keep at least a couple of months in stock, but I am a part of the Lupus Foundation of Indiana specifically, and I know there are a lot of people who are having trouble getting that, especially if they get their prescriptions from a local pharmacy. A lot of them are either on back order or they're not filling their full 30 or 90-day prescription. They're only getting a couple of weeks at a time just because it's uncertain right now what their stock is going to be like in that. So, you know, hopefully there's enough for everybody. That's the ultimate thing. Everyone with lupus or those with COVID-19 who are fighting it, and they are finding success in this drug. That's our goal, is to make sure that everyone has access to potentially medications that will work in their favor. So that's what I know from my side of things.